And action. Mr. Patel had a question about if he should be taking B12. And here's how I would answer it. Anybody that's a vegetarian really should be on B12. Truthfully, even if you're a meat eater, you should have your B12 levels checked, either once a year during your physical or when you're feeling symptoms. What are the symptoms? If you have any problems with fatigue, I would check a B12. If you're having any problems with memory or mental clarity, brain fog, I would check a B12. If you have a PPI, like omeprazole, Prilosec, Prevacid, Axid, Pantoprazole, all those are PPIs or proton pump inhibitors, usually used for reflux nowadays. Some of them are over the counter, some of them are prescription, but if you use any of those medicines for reflux, then the likelihood of your belly not making enough intrinsic factor is high. If you don't have intrinsic factor in the lining of the stomach that's being made and secreted when you eat your meal, that's high in B12, you can't bind the B12. If you can't bind it, you can't absorb it. Usually what happens is your stomach gets a sense that a meal is coming down, probably fatty, meaty, protein, and then it secretes intrinsic factor from the cell. Now, when you have that B12 in the food that's broken down with the stomach acid, bind to intrinsic factor, it goes down the line, the small intestine, gets to the farthest part of the small intestine. There's 3 portions, and in the farthest part, the B12 and the intrinsic factor get absorbed. When it gets absorbed, it gets into the bloodstream, does its magic. But the problem is people who have problems with absorbing, like people who are on proton pump inhibitors, and or people who drink alcohol. Alcohol will erode the lining of the stomach. Alcohol will cause problems with B12 being pooped out too fast without being absorbed. That's why there's something called Wernicke's encephalopathy, where patients have this weird blood pattern on blood testing and this typical form of behavior that's unusual with memory issues. Usually when they come into the emergency room, we give them thiamine, B12, and some things turn around. Sometimes they don't, but still it's because of absorption. And that brings me to the next problem. Sometimes people with Crohn's disease, irritable bowel syndrome, people who use Imodium a lot or Miralax a lot, those folks probably should have a B12 level checked, because the likelihood is you're not absorbing it properly. People who have had bypass stomach surgery for bypass or Roux-en-Y, you also are not absorbing properly, so you should have B12 checked. And you know, it really should be a part of many of the panels that you do for a wellness exam, but some docs just don't check it. Sometimes they'll wait for the CBC to be abnormal, and then when it's abnormal, that's a blood count, then we'll go backwards and check the iron and B12. But half of America, no, more than half of America is obese. And usually with bad eating habits and irritable bowel or malabsorption or just eating a lot of fast food, you're not going to get it anyway, so guaranteed you should check it. I use it as a standard when I check my patients and give them guidance on lifestyle change, nutrition change. So what would we do, or what would happen if you didn't do B12? Well, I mean, most of the time we're chasing a blood test, meaning that we see an abnormality or a deficiency on blood test and we fix it, because we have to have proof before we give intervention. Sometimes I'll look at those symptoms of patients, because I see a lot of chronic pain and a lot of fibromyalgia, a lot of IBS, a lot of Crohn's. So I'll check that anyway. But I'll find a lot of people. The majority of my patients are B12 deficient, including myself, but I'm semi-vegetarian, so that explains that. I take oral B12, and here's how we take care of it. There's been controversy on who gets what. So I can guarantee you this. If you do get B12, a lot of my patients anecdotally will get a big energy boost when they take this one. This is injectable B12. Injectable B12, that's 1,000 milligrams of cyanocobalamin straight into the blood vessels. That's usually through the muscle, but through the muscle gets in the blood vessel. And with a shot once a month, can have, or usually will say that they have this energy level that's just boosted for about 3 weeks, and then it tapers off. I can't explain, because there's no evidence in the literature that says it's supposed to do that, but it's okay, because again, I'm treating a deficiency. If they happen to have an energy boost, hey, better for them, but that goes to show you that B12 deficiency usually ends up with some form of fatigue. And in these patients, it was unrealized or unnoticed fatigue until they got the shot, and suddenly it's like life was pretty decent. Now, that didn't change around 100%, but it certainly helped with the course of the day. So if patients are coming in just for the shot and they have good B12 levels, well, it's not medically suggested. Although, if it drops, then I'll start the shot. So what do we do when the patients reach to a good level after about 6 months of shots? The option is there to switch over to oral form. The oral form of B12, whether it's sublingual, capsule, or powder in liquid. I mean, cyanocobalamin is the cheapest out there, 1,000 micrograms per day of cyanocobalamin should get in, whether it's sublingual, capsule, or powder. I don't have a preference. This is what I would do. I do whatever you can afford. And again, there's questions about cyanide in the cyanocobalamin leaching off and causing problems with cyanide toxicity. I haven't had anything yet. Whether people should get methyl or whether people should get other forms of it. You know, again, if it's deficient on blood testing, and if we replace it, then whatever you're taking is working. I have some patients that go high end and spend a couple, probably 30 to 40 bucks for a month. And then I have patients that go low end and spend $5 for 5 months. If they both get in and they have their blood tests that show fixed deficiency, whatever you want to pay, I don't care. But I would rather have you go as little as possible so you can spend money on food. And yes, we should be getting it in food, but in some cases, a lot of my patients have zipped down on the proportions of their foods or the portion size, and adding a source to take care of B12 might be more calories, more size, more volume, and we're back to square one. B12 is taken care of, but they're taking in too much volume. So that's a push-pull, but I think it is necessary to fix. I think if it's a deficiency, it has to be fixed. If there are patients with diseases of malabsorption, it should be checked. If there's patients with a fatigue issue or that are vegetarian, it should be checked. So, Mr. Patel, in the case of what we're doing, I'll let you decide if you want to get a shot. Sometimes once a month shots will be covered by insurance, which is kind of cool. If they're not covered by insurance, but you just want to get an energy burst, try it and see what happens. If they're not covered from insurance, you don't care about energy, just go with oral, and then we'll see what happens in 3 to 6 months when we repeat the blood test.
So when you come in for a B12 shot, it's a monthly thing. It sometimes will get in more guaranteed than taking a pill. So it's up to the patients. Some people have don't like shots. Some people would rather just deal with it because it's easier to take an extra pill. And a lot of my patients take a handful of pills twice a day, so one less pill is probably good enough. But the beauty is that you can guarantee that it gets straight into the bloodstream. In addition, there is this energy increase that a lot of people will say they have. I think it lasts for about 3 weeks with most folks, but just for that reason, fixing fibromyalgia or taking care of chronic fatigue gets a nice response, and that alone, that alone would be worth taking the shot. Sure. So usually what we'll do is this. You don't really need blood pressures. You don't really need vital signs taken. Typically it's in and out. You don't have to see me.